It is another interesting edition of a program of Choice Health Affair on AIT, a platform where we focus on public health issues, challenges of women and children with a view to providing lasting solutions. I am your regular anchor, Ushomo Wadanies. Our focus on the program this week is on bombs and keloids. Let's take it through our new segment before we come back to the topical issue of bombs and keloids. Please stay tuned.
Well, I think we need to be very deliberate in the planning and management of our healthcare delivery system. And one sure way, if I'm going to give a very brief response, is that we need to empower health facilities through decentralization and giving authority to local managers and involving members of the communities in the management of facilities providing services to them. That, in my opinion, will help us to ensure efficiency. But the technology has to be appropriate, it has to be at the level of our development, but critically what is most important is to involve the end users of facilities in the management of those facilities, and then they will have to decide what level of technology is appropriate at their own level of development.
The challenge of healthcare in Nigeria is number one, is that you have bad policy maker. They don't understand what is needed in terms of healthcare. A lot of them sit down in the office, they are not clear, they are not on ground to understand what we need. Like for example now in Lagos State, we have what the Lagos State Health Reform Law of 2006. Until now, they are not being reviewed. Lagos State need immediate and urgent review of the Lagos State Health Reform of 2006. Look at the healthcare in terms of value change. What are the challenges that we see from policymaker to patient care? Number one is the major one is the issue of Japa syndrome, which is brain drain. Even many health workers, especially doctors, are leaving the country in droves. And if government is not ready to resolve this problem, we are still wasting our time. Unfortunately, government at federal and state level, they are focusing on building more medical schools, more health service institutions. No, if you build more schools, who is going to teach them? Where are the doctor to teach the medical student? Number two, that even if you produce them, are they going to stay? Yes, the country will now become the second most exporter of doctors. At the end of the day, what do we gain from it? What we are saying is that, one, you solve the issue of Japa syndrome, which is brain drain. Two, budgetary allocation to health should increase. Health finances should improve. Infrastructure should also improve. Training and retraining of health workers should be done. Welfare package should be done to the health worker, should be given to the health worker, and also conducive environment which reduce overwork, burnout, psychological problem, and mental problem that the doctor encounter during health delivery.
We all know that AI has come to stay in all areas of life. And even medicine and healthcare is not left behind. So it's high time that the medical practice and practitioners get key in touch with this revolution. And of course, I understand the challenges, the step back about our ethics. So we must align our ethics, in line with the ever-changing dynamic healthcare landscape.
Currently, the artificial intelligence is being incorporated into mental health care and research. And the advantage of this cannot be overemphasized. More so that we don't have enough mental health experts to take care of the people all over the world. For instance, in Nigeria now we have less than 300 psychiatrists to take care of over 200 million people. So the role of artificial intelligence is very, very important to us. One, in the assessment of patients, in the diagnosis, even in the recovery and in the treatment. Currently, we are now having virtual therapists through artificial intelligence, meaning that Some of our psychological intervention can be delivered through artificial intelligence. And if this is the case, that we are now using it in the mental health treatment, then there is need for us to also take note of it in the area of research. So the artificial intelligence has come to stay, even in developing countries, the third world, like Nigeria. So more so that it's so useful for us in both the assessment, in the treatment, and in the recovery, as well as research in mental health. Very soon now, some of our patients may not even need to come to the hospital to access treatment. In the comfort of your home, in your office, or wherever you are, once you have a smartphone, you can access mental health services. And if you need any treatment, this will be delivered at your doorstep. Once all the procedures and all the conditions are met.
The world is changing, and it's a digital age. So as the world changes, mental health, which is part of the world, also needs to change. Why AI? Several decades ago, we moved from different stages to advanced stage, and currently is a global village. When we talk about mental health, it goes beyond those that have mental health issues. Everybody has mental health, and the mental health of everybody matters. But we won't be able to address the current need of mental health without moving with the digital age. Now, with respect to the AI, in the past decades, research had been a traditional way of measuring how mental health is, how people feel, how they behave, and having to do research is important in documentation and planning for the health of the whole nation. In fact, there can't be health without mental health, and this health needs to go to the doorstep of every individual in any community.
In developed countries, AI has been introduced, and we start seeing the value, benefit of AI in mental health diagnosis and treatment. And we've seen cases where even the government, they see the value because, for example, in the world, we have about 1.1 billion people who have mental disorder in one form or the other. In places like America, we have about 57 million adults who are diagnosed for mental health. And the healthcare capacity is not sufficient to handle this volume, not just in America and also in Nigeria. And that's where AI comes in to give the opportunity for all to afford everybody, anybody who's associated with mental disorder, right, to have opportunity to be diagnosed, to be treated, and that's what AI comes in. That's where AI comes in. All misunderstanding that we see is that people believe that AI is going to take their job. AI is a tool. It just gives us a leverage and makes us more efficient and cost effective. It's like you want to travel to Port Harcourt and you want to trek. Now you can see the value if you have a vehicle or a car that can take you there within 2 hours. That's the value AI is going to add to us. It's going to onboard. We are not going to lose anything. So I just to make our work more efficient, more accurate, and more reliable. That's what AI plays in. It's not going to take anybody's job away.
The Access HPV project is a cervical cancer prevention project. And why is it so special to us? Cervical cancer is a disease of public health importance, but interestingly, it's one of the most preventable, it can be prevented by 100% and most treatable forms of cancer if detected early and treated effectively. But the burden remains high in countries like Nigeria, in low and middle income countries. Globally, cervical cancer is the 4th commonest cancer among women. It's been reported by the World Health Organization in the year 2020 that there were over 600,000 cases of cervical cancer with 342,000 deaths of cervical cancer. And 90% of these cases and deaths occurred in low and middle income countries. Nigeria is one of those countries. Coming down to Nigeria, cervical cancer is the second commonest cancer among women in Nigeria, and yearly we record 12,000 cases of cervical cancer and 8,000 deaths due to cervical cancer. And so it contributes to the high level of morbidity and mortality in this country. So this is a huge burden for us. And in order to tackle this burden, the World Health Organization launched a strategy in 2020 to accelerate the elimination of cervical cancer as a public health challenge by the year 2030. And how is it going to achieve this? It's using a three-pronged approach. And one of it is to vaccinate girls, 90% of girls by the age 15 years. And the next strategy is to screen 70% of women with high-performance tests, which is HPV tests, at the age of 35 and 45. And the final one is to treat 90% of women diagnosed with precancerous lesions or invasive cancer adequately. And with this, it will be able to eliminate cervical cancer. And how do we come into this? The Nigerian Institute of Medical Research has always played a key role in cervical cancer prevention in Nigeria. And in order to strengthen this role, this project was birthed, which is the Access HPV project. It's in collaboration with Washington University in the US, University of North Carolina at Chapel Hill, Wake Forest School of Medicine in the US, Monash University in Australia. And what are the aims of this project? We aim to improve the uptake of HPV vaccination among girls 9 to 14 years and improve HPV screening among women 30 to 65 years in Nigeria. We have specific aims, and our aims is first to develop new HPV vaccination campaign for girls 9 to 14 years and HPV self-collection campaign using crowdsourcing and participatory learning community groups to get this new campaigns. We have Borno State, we have Kano State, Kebbi State, Delta State, Anambra, Imo State. So we have states in the 6 geopolitical zones, including Federal Capital Territory in Nigeria. From the different strategies, the most acceptable that had a very good outcome was Mother-Daughter Day strategy. And what is this Mother-Daughter Day strategy? A site will enroll eligible participants. Each site is supposed to enroll 50 mother-daughter pairs from the 18 sites, and once they consent and are enrolled, they are invited for this Mother-Daughter Day. It's an opportunity for the mother and the daughter or the female caregiver to bond with the daughter. And before you become part of this study, the child would have not taken HPV vaccine, and the mother too wouldn't have been screened for HPV, and so that makes them that's one of the eligibility criteria. So they are invited for this Mother-Daughter Day. At this venue, it's supposed to be an interesting activity. At this venue, they provide awareness on cervical cancer prevention services, about HPV vaccine and HPV screening. And afterwards, on-site services are provided. At that site, the girls are vaccinated for HPV, and the woman receives HPV screening in a private space. And so we're able to provide holistic cervical cancer prevention package to these women. Now, the sites have been divided into 4 steps, and each step comprises of 4 to 5 sites. And so step 1, step 2, step 3 have implemented, and a final step will be implementing in November. And this is the 4th year of the study, and we hope to determine the impact and cost effectiveness of our strategies before we end the study. And there were some challenges along the line while we were implementing, because going into the community, you find out that, yes, there are prevailing myths and misconceptions about the HPV vaccine. And so it gave us an opportunity to engage the community and address such concerns. And with that, we're able to get a buy-in from the community to improve the uptake of HPV vaccination amongst those that were enrolled. And the availability of the high performance, the brushes used for the screening is something not readily available in the country. And so with this, has been promoted, HPV vaccination and HPV screening has been promoted as an effective cervical cancer prevention strategy. But there's limited access to this, and that is what we're trying to do to ensure that we improve the uptake to these services, thereby contributing to cervical cancer elimination through the global goal.
For NIMA and the setup of clinical trial, what are we looking? So NIMA is aligning our clinical research agenda with the President Bola Ahmed Aswaju program on unlocking the value chain for healthcare. So that we're on feedback again. So we are, and this is actually trying to see how we can strengthen clinical research and clinical trial across the country. So NIMA is on the board of the National Clinical Trial Consortium of Clinical Research Head that feedback is put together. So we hope to be able to support local drug diagnostic vaccine manufacturing and generate clinical evidence to support precision oncology and enhance the market entry generally. And we also want to set up collaboration with the regulatory agency, other research institutions, feedback, and see how we can take this agenda of clinical trial forward and collaborate with other industries, and also develop research cluster linking university teaching hospitals, private contract research organizations to NIMA program. In conclusion, I would like to say that randomized clinical trial and advanced medical research represent a cornerstone of nation's commitment to advancing health through science. And with a legacy of integrity, technical competence, and public trust, NIMA continues to set the benchmark for clinical research in Nigeria and West Africa, and by expanding its trial portfolio, strengthening infrastructure, and aligning national initiatives such as PBAC, NIMA is not only shaping public health policy, but also driving the localization of health technology, therapeutics, and critical, which is critical for achieving the national health security and self-reliance.
Yes, we need money for research. We have limited funding. But it is not true to say that government has not in principle approved some money for NIMA for research. Of course, there's a difference between appropriating money and accessing the money. They're two different things. But that said, whatever has been provided, we have to send information out to researchers to send in proposals. Have we done that? Yes. But when you send in a proposal, you have to defend the proposal. We have proposals that we have screened and found acceptable, 2 from Ogun State, about 3 from Lagos State, 2 from Southeast, 1 from Sokoto, and Professor Ezechi and another professor are supposed to be looking at these things in conjunction with finance to see how we can fund those things with the little money we have.
A healthy population, people often say, builds a prosperous nation. But many Nigerians are threatened on a daily basis and die needlessly due to diseases, poor health care, malnutrition, and lack of access to relevant health information. The sorry state of our health infrastructure is also a major challenge. On Health Affair, Oshomo Daniels brings these challenges to the attention of relevant authorities for a lasting solution. For sponsorship and advert placements, please call the numbers showing on your screen. Health Affair, your access to good health through relevant information.
Bumps are a general term used for any small raised area on the skin surface, which can include keloids, razor bumps, and the likes. Keloids, on the other hand, are a specific type of bump, an overgrown, hard, raised scar that forms after a skin injury. While other bumps might be temporary, keloids are permanent and often larger than the original wounds. We have an expert with us on the show today to tell us more about bumps and keloids. He is Livinus Emeronye, a pharmacist and a public health advocate.
There are health conditions, just like every other health condition. And basically, bump and keloid, they are raised growth. They have normal growth from the skin. If you look at your skin, if you have your normal skin, you will see bump or keloid. So when there's a raised growth, that's where you get bump and keloid. And the major difference is that bump is more broad, unlike keloid. And a lot of factors or things can cause bump, unlike keloid. When you look at keloid is just mainly from wound healing. When that wound heals due to excessive presence of collagen, more like steroid, that is what talks about leads to keloid in its own. Bump, so many things can cause bump. Either bacteria, allergic reaction, like boil and all this stuff. When you shave and they're more like contaminated shaving, and you're sensitive, there are some people that suffer from contact dermatitis. If they put on like chain, whatever, they start itching and scratching, and if the things start growing. If you have wounds and all this stuff, so those ones, that's basically the difference. But in a layman's term, both bump and keloid, they raise growth. Yes, one person can have both keloid and bump at the same time, depending on what is responsible. If you're having bump and you have a wound that is healing, or the thing heal fast and start growing, that's keloid. So one person can have both. And then looking at where they occur different places. At every part of the body they occur. When you look at those ones at the neck, at the back, it's just because it's a pronounced. So that's where people see that they're seeing it. If you see your chest, or you see your back, or you see your inner side, there's no place you cannot get bump. Bumps and keloid can occur at any part of the body system. But the ones that are pronounced are the ones that people see. If I have an accident on the face and I have a color, I have bump there, or keloid, people will see it. If it's inside my distance, nobody will see what I'm carrying. So it can occur at any place. It's not that that's position specific, but they can occur at any place. Secondly, your question about bumps and keloid being cancerous, my answer is no. They are not cancerous. Bump cannot become cancer. Keloid cannot become cancer. But when they are growing and they are not being treated, they can overgrow their limits. And in the process of that overgrowth, if the person is prone to cancer, they may develop, but not that they're having cancer because of keloids. That's the message. Bumps cannot lead to cancer. But if it's the person that is prone to cancer and is having cancer and all the whatever, the person may develop cancer, but it's not because of that bump or keloid. In other words, bumps doesn't cause cancer. Keloid doesn't cause cancer. Bump and keloid cannot lead to cancer.
So how big can they grow? Can they stop growing by themselves, or somebody has to do something to stop the growth by way of treatment?
You have to treat it. And if you don't treat it, they'll be getting bigger. Are you getting me? So there's need for one to treat it. And again, if you're treating keloid, for instance, and you're not using the right medication or the right remedy or the right approach, it may be drying up. When you stop it, you start coming up again. Then the keloid, if you see the bump, for instance, now the ones at the back of the neck, if you're shaving and all those things, you're not treating them properly, they will start growing. From small one, they become multiple. Before you know it, the whole place will be covered and become more like an eyesore.
So especially for guys who have that thing on their head, what would be your advice for them, and generally advice for people who have keloid and bumps, what they can do to prevent, and those who have it, how they can manage it?
There's no problem with that solution. If you have bump, our major problem is getting the right treatment. That's the major issue. There are some things, bump can be treated, keloid can be treated. one, they will stop growing and they start shrinking. First condition for bump is cleanliness. If you look at those causative factors, like I told you earlier, different things can cause bump, unlike keloid. Now, if you address those factors, if you are shaving for maybe what is causing your bump now, the one at the back is where you shaved, unsterilized shaving equipment and instruments and all the stuff, sterilize them. Use aftershave. If you use the right one, then look at the sensitivity of your skin and adapt. We all are alike, but not the same. People react differently to different things. So if you know what is specific to you, you do it. If you have bump, you dress it. If you treat it very well, it will go. Some of the people, when they have the bump and the keloid, it will be itching them inside. It becomes more like irritation and very discomforting. So you need to look at those things. Are you addressing the symptoms? Are you addressing the signs? Are you addressing the issue? That's where combination therapy comes in. There are some things you use, conventionally and otherwise. It will stop growing. The itching will be reduced. If you're allergic to some of these things, they stop. But the issue is knowing the right approach to use.
Any other thing you want to say?
Yeah, my message is
about bumps and keloids.
We need to be health conscious. If you are not having bumps today, thank God for it. Whether you're a man or woman, be health conscious. Maintain high degree of cleanliness. If you go to barbing salon or any place you're looking at it, just be conscious. People doing tattoo and all this stuff, or needle, abusing drugs, or some of these things, they should be very careful. One, accident is something that happened. It's an accidental issue. No one plans for it. If you have accident, treat yourself, depending on what you can afford. As you are treating those things, look at the issue. If you have keloid, maybe as a result of a minor accident or serious accident or major accident, then you know that you have tendency for this. You have to be more health conscious, safety conscious. Then treat it. Yeah, the keloid is, when you look at keloid, collagen, or more, how do I put it now? Let's come into a case of hormonal imbalance. When there's excess collagen in the process of that wound healing, that's what leads to that keloid. Steroid and all this stuff. You know, like in homeopathy, for instance, what causes a disease can treat it. So those things now, if you look at, that's why I'm saying that when it comes to some of these issues, having a skin culture, diagnosis, and all the rest plays an important role, right? So when you have that keloid, there are some things you apply, topically and otherwise. It will be shrinking. It will be shrinking, and it will stop the growth. This itching, sensitivity, and all the rest will be reduced. But again, it's who is involved. So there are some there are some steroidal products that help to stop that allergic reaction, but people abuse them. If you look at prednisolone, or dexamethasone, or betamethasone, all those zones you are seeing, those things are just steroidal products. The level of abuse is much because it's accessible. I'm having this thing. So when people abuse such, it leads to another thing. But the bottom line is, bumps can be treated and cured. Keloid can be treated and cured. But the issue again is, who is involved? Who is doing that? The patient, the clinician, and the product used play a vital role in such.
This is where we draw the curtain to the close on the program today. Thanks for spending your time with us. Let's do it again same time next week. Please endeavor to advertise your health products and services on the program. I remain yours truly, Ushomo Daniels. Please keep staying safe.